I am Michele Herndon. I am the Program Director for Patient Navigation at the Undiagnosed Diseases Network Foundation. I started with the foundation back in September. Before that, I worked for 18 years as a pediatric nurse and nurse manager at St. Louis Children's Hospital. And in addition to being involved in rare disease, undiagnosed disease as a clinician and as a pediatric nurse, I also was the mother of a patient, my oldest son, who had a undiagnosed journey of about 6 or 7 years and was ultimately diagnosed through the Undiagnosed Diseases Network. So I have a professional and a personal tie-in to the work that I get to do now.
And I'm Sessions Cole. I am a professor of pediatrics at Washington University School of Medicine in St. Louis and St. Louis Children's Hospital. I am trained as a neonatologist, a baby doctor, and through my clinical practice in the neonatal intensive care unit, I've come across a large number of babies who have unusual characteristics that don't fit into a known syndrome. And that experience led me to lead an effort here at Washington University School of Medicine to become a clinical site in the Undiagnosed Diseases Network in 2018. And more recently, I have become a co-principal investigator for the Undiagnosed Diseases Network Data Management Coordinating Center, and I serve on the Undiagnosed Diseases Network Foundation board. So I have personal experience as a physician taking care of these patients, and now over the last 7 or 8 years, I've expanded that experience via the Undiagnosed Diseases Network and the Undiagnosed Diseases Network Foundation. The plight of patients and families who have objective clinical findings that don't fit into a known disease entity, the plight of those patients and families is very lonely. They frequently hold out hope that a diagnosis can be found. There are about 30 million of these individuals in the United States, so about a little less than 1 in 10 individuals in the United States have a set of problems that currently do not carry a diagnosis. And so those patients and families are on a constant diagnostic odyssey. And as you might imagine, that diagnostic odyssey occupies all of their emotional and physical energy. And so it impacts all parts of their lives. In addition, because these patients and families do not have a diagnosis, they have no community to which to turn to try to get support, advice, to help them to the next step. And so these undiagnosed patients are, quite frankly, desperate. And they need help, first of all, in getting access to resources that will help them find a diagnosis. And then second of all, once they have a diagnosis, making sure that they get access to all of the resources that the diagnosis can provide them in terms of access to support and community. Well, a diagnosis is like a North Star, and it provides a patient or a family with knowledge that not having a diagnosis, leaves completely unfulfilled. So the importance of a diagnosis, first of all, is that there is a degree of relief about both knowing what the problem is, but also knowing what the problem isn't. It means that there are ways of approaching the symptoms that an undiagnosed patient with now a diagnosis has that might not have been thought of. before the diagnosis was made. Sometimes, for example, knowing the diagnosis, one knows the exact problem and pathway that's disrupted, which focuses possible strategies for relief of symptoms. Even if there's not a cure for the problem, at least it focuses strategies for relief of symptoms. Second of all, it basically eliminates the exhaustive diagnostic testing that all patients and families go through on a regular basis when they don't have a diagnosis. Third of all, if it's a genetic diagnosis, which the vast majority of the Undiagnosed Diseases Network participants have, if it's a genetic diagnosis, that diagnosis informs something about prognosis. It informs something about recurrence risk. So would this problem happen again in future pregnancies or in future children? Would the problem possibly happen in first-degree relatives, sisters, brothers of the couple who parented the child? And so informing reproductive risk is a major part of getting a diagnosis. So I would say there are many important impacts of having a diagnosis, and there really is no other way of providing that kind of support to a family without a diagnosis.
Well, from a practical perspective for the families, and Dr. Cole mentioned this earlier, there are certain grants or certain programs that you cannot qualify for if you don't have a diagnosis. For example, my son needed a special piece of equipment that our health insurance didn't cover. Well, there was this grant program for neuromuscular diseases, but it was like you had to check a box of he has this disease, and I could not apply for this grant program because he was undiagnosed, even though what he had was obviously neuromuscular. So, that's just a practical thing. There are scholarships in our state that, grant programs in our state that we live in that he couldn't qualify for because I couldn't give him a diagnosis. There are support programs. I recently found one at a rare disease conference. It sounded so amazing. It was more of a recreational program for people with rare diseases. And I said, oh, well, are the undiagnosed included? And they said, well, I don't know. Are they on this list? And no, they weren't on the list. And so from a practical perspective, there's that needing a diagnosis. But then, as Dr. Cole said too, finding your community. I did everything I could to find a community for my son, and I had to do it, and this is common, based on symptoms. So my son lost his hearing, so we joined the St. Louis Teen Deaf Club. My son used to get infusions and had like a port, it's very similar to cancer patients. So I reached out and said, do you have a teen cancer support group? He doesn't have cancer, but he has a lot of the same feelings going on. And so you just would try and find groups that fit a little bit, but then even in that group, you didn't fit because no one else in the Teen Deaf Club was also in a wheelchair. And so it was just so hard to find community and true people who understood.
Without a diagnosis, there's really no hope for a cure or a therapy. And while rare disease patients have, are very much underrepresented in terms of having access to therapies that might help them, having a diagnosis means that therapy can be pursued, and that possible cures can be pursued. And that kind of hope is so critical when a family or a patient is trying to deal with the extraordinary number of problems, issues, accommodations that undiagnosed patients have.
My oldest son, Mitchell, was 12 years old. he was born in 2000, so it was always easy to remember how old he was. So in 2012, he was 12, and he had been normally developing. The only medical problems he ever had was asthma. And all of a sudden at age 12, he just started walking funny. And he said, my legs feel weird. And remember, I'm a pediatric nurse, right? So at first I was like, yeah, you're fine. You're okay. You're just growing. A lot of people told me that. Like my brother had a growth spurt in it and he tripped a lot or his legs felt weird, but he's fine. So, for a few weeks, just you're okay. And then I started seeing things for myself, just walking funny. His gait was different. I actually, in my bedroom, I remember having him do what's called a tandem walk. Like, I want you to walk on this line and put your feet, I'm doing my own neuro exam at home, my limited knowledge of a neuro exam, and he couldn't do it. He lost his balance. And so I had a great family doctor who did their own neuro exam. And one of the first red flags was they couldn't elicit any reflexes. So banging on the knees and banging on the elbows, there were no reflexes. And so again, this is a very long story, but he referred us to an eye doctor because my son was having really dry eyes and they wanted to see were there any, brain tumor signs that maybe the eyes, could show. And then we went to a neurologist at St. Louis Children's Hospital where I worked, which is another part of this story, and went there for that visit. And I was convinced they were going to say he had a brain tumor, and later I found myself saying, I wish he had had a brain tumor, which sounds like the craziest thing to say, right? But when you don't have a diagnosis, even a bad diagnosis sometimes feels better than being undiagnosed. So initially the neurologist thought brain tumor as well, head CT, nothing there, totally fine. Ultimately had an MRI pretty quickly, which found some spinal cord inflammation. It was a long journey of multi-system problems, and that's frequent with undiagnosed, that they have systematic problems that affect all different parts of their body. And so my son had eye problems. He lost his hearing suddenly. He couldn't walk. He had rashes. So it's, a wide variety of symptoms. He had, what we thought was a relapsing, remitting course. So he would be in a wheelchair, not able to walk. He would go to therapy and rehab. Then he could walk again, but his plateau was always lower every time. So every time he'd get better, it was still in a downward trend. And so a doctor who had cared for him at St. Louis Children's Hospital finished her fellowship and went to Baylor College of Medicine, where they had an Undiagnosed Diseases Network site. At the time, this was 2017, Washington University in St. Louis did not have they were not a site yet, but Baylor in Houston was. And so that physician suggested I apply. And my son and I were accepted, and we traveled to Baylor for a 4-day extensive appointments, interviews, skin biopsies. We also got to go to the NASA Space Center, and that was really cool, but that wasn't related to this. But it's a great memory that the two of us have. So through that, and through doing whole genome sequencing on my son and my husband and I, they found that he had a gene change that had been there 6 years ago when they had looked at a small portion of his genetics, but it was at that point identified as what's called a VUS, or a variant of unknown significance. And they just said, well, that's not what it is. But the Undiagnosed Diseases Network decided it needed to be studied further. And again, long story short, they manipulated the genetics of a fruit fly to give the fruit flies the same genetic mutation. The fruit flies couldn't fly. The fruit flies had other symptoms that convinced them that that was the genetic mutation causing my son's problem. So ultimately, the disease was named Mitchell syndrome. It was confirmed when, through a gene matcher platform, they found one other patient. And that, really is kind of the confirmatory evidence there, when you can find a patient with the same genetic mutation and same phenotype or, physical attributes. And so from there, they found another patient, published about this new disease in 2020. And we are now, 4 years later, at a patient population of about 30 patients worldwide who have the same genetic mutation. So my son passed away in 2019. There are some therapeutic options that we're exploring with the FDA, with researchers that, wasn't in time for him, but, in his memory, we're working towards making it possible for future patients.
And I think the Undiagnosed Diseases Network sort of brings a secret sauce to the diagnostic process, because usually when patients are undiagnosed, each patient goes first to subspecialist 1, then to subspecialist 2, then to subspecialist 3. And all the subspecialists are terrific, but there's very little interaction in trying to put together what the subspecialists think as a group. The secret sauce of the Undiagnosed Diseases Network is that it intentionally and regularly brings together a wide variety of subspecialists, not only clinical subspecialists, but specialists in gene decoding, specialists in trying to figure out how to confirm a previously unknown sort of gene problem is in fact the cause. It brings these people together on a regular basis, and that kind of grouping together, collaborating together on a regular basis builds a kind of consensus strategy that really moves diagnostic possibilities forward for these undiagnosed patients in a way that really can't be done, but what I would sort of traditional diagnostic strategies.
Right. Our subspecialists had referred us to other subspecialists in other hospitals. They had talked to others in their community. They put it out on, listservs for neurology. But what really kind of cracked the case was when the Undiagnosed Diseases Network got together and pulled together all the clinical notes, but then had these bench scientists who are like their focus are specific genes. They spent their entire career looking at specific diseases, specific genes, and a couple of them said, we really think this gene is something that you should look into.
So the patient navigation program is led by Michele, and it is a program that has been started by the Undiagnosed Diseases Network Foundation in an effort to provide the kinds of resources and support that undiagnosed patients need as they proceed through their diagnostic odyssey. I can tell you strictly from somebody who's been in the game here for a while, this program is really a game changer for undiagnosed patients.
The program is for patients and caregivers. Patient navigation was actually born in the cancer world. In 1990, there was a physician in Harlem who saw that his patients who were poorer, didn't have as many resources, were getting diagnosed later and had much poorer outcomes. And he developed this navigation program to help guide cancer patients to testing and to prevention. And so that's really where navigation was born and has grown, is in the cancer population. And it quickly spread to other areas, mental health, transitional care. And when I was going through all of this with my son, I just kept thinking, we need an undiagnosed or ultra rare navigator. I need somebody to tell me what I don't know, because even though I was a registered nurse with a master's degree working at an urban amazing medical center, there was so much I didn't know. So that's really where it was born, and it's for patients and caregivers to support them in a variety of ways.
It basically provides a support mechanism that doesn't require a diagnosis or a community. It provides the undiagnosed community with resources and information that are otherwise only anecdotally accessible. for patients and families who are undiagnosed.
Well, my first advice right now would be to please reach out and see about our patient navigation program. As of right now, the way they can connect with us is info@udnf.org, and just let us know they're interested in the navigation program, and we can partner them up with the patient navigator. The great thing about our navigation program is the majority of the navigators have either been undiagnosed themselves or are rare patients or caregivers. And that's the great thing about, traditional navigation. It's getting support from someone who's, quote, been there, someone who has lived the same experiences, maybe not exactly, but, a similar experience. So, of course, please reach out to us and, find out more about patient navigation and what we can offer you. We have a community on Facebook as well, the UDNF Undiagnosed and Ultra Rare community. Again, we don't have a diagnosis, but we kind of are a group, the Undiagnosed, and you can support each other in that. So do what you can to reach out to us to learn about our navigation program, and then try and find community wherever you can find it. And I suggest our Facebook page for the UDNF Undiagnosed and Ultra Rare patients.
And I would say that a family or a patient, as a sort of a first step, needs to find what I would term a provider quarterback, someone who knows the patient or family or child, and it could be a primary care doctor, it could be a subspecialty doctor, could be a nurse practitioner, could be a genetic counselor, but someone who is willing to partner with the family and move the family through help the family move through the diagnostic process. And when a family provider dyad sort of feels as if there's sort of no more, they've run out of strategies to try to make a diagnosis, they should contact the Undiagnosed Diseases Network by email or call our call center, and we'll try to help them figure out what the next steps would be. It can be, hard, especially when, for example, patients and families are in rural areas where the resources are really spread out and may not be easily accessible. The Undiagnosed Diseases Network has really made a lot of progress, again, prompted by the COVID pandemic, to try to extend its resources to be able to use telehealth strategies to begin to advise and evaluate patients. But getting access to the network, the Undiagnosed Diseases Network, provides the family or patient or child and his principal quarterback provider with resources and advice about what would be the next steps in terms of trying to make a diagnosis.
Our services with the patient navigation program, we want to be holistic, and they really are individualized. And so, we're going to be working with the families, determining what their needs are, even beyond appointments or, getting in the UDN. It's, if they're having difficulty finding a mental health provider, if they have food insecurity, if they're having housing or utility payment difficulties, we're going to do our best to connect them and then have loop closure with social support agencies in their area. And so that's something that we want to help with, because while you're trying to deal with this undiagnosed situation, the journey, hospitalizations, appointments, life is still going on for these families, and we want to do whatever we can to help alleviate that burden.
The Undiagnosed Diseases Network is doing everything it can to create strategies that help develop trust between the network, the Undiagnosed Diseases Network, and a whole range of undiagnosed patients. The Undiagnosed Diseases Network recognizes that because of a variety of long-standing discriminatory practices by multiple parts of the healthcare delivery system that some undiagnosed patients may not trust, sort of getting involved with an undiagnosed diseases network or an undiagnosed diseases network foundation. I want to try to reassure them that we are with you, that we understand we have to earn your trust, and we're prepared to do that in a way that you believe.